Hello, welcome to my YouTube channel. This is Nurse Modesty, and here on my YouTube channel I'll be talking about mothers and babies' health. And today I'm going to talk about cracked nipples. These are problems that most new mothers, and not even new mothers alone, they experience problems with cracked nipples during breastfeeding, especially the first month of breastfeeding. Um, the causes of this, the first one may be incorrect latch and positioning. And by saying latch, I mean this is how the baby attaches on the breast while feeding. And positioning is how the baby is positioned as she or he breastfeeds. Uh, when the baby is breastfeeding, they are supposed to cover the nipple and the black part, which is called areola. Part of it is supposed to be in the baby's mouth. This makes the nipple to be behind the baby's mouth, making it not to be irritated and to form the cracks. And if the latching is too shallow, that is, the baby is just sucking from the nipples, this is when you may find there may be friction, and you'll get the nipples being irritated. Another problem that may cause cracked nipples is tongue tie or any other mouth condition like lip tie and high palate. Tongue tie, this is when the baby's tongue, you may find it is not, it is tied to the lower side, so it may need to be cut so that the baby is able to breastfeed well. Another issue is nipple confusion. This is when you may be giving your baby the pacifier or feeding from the bottle. This confuses the baby because the texture of the feeding bottle or pacifier and your nipple is very different. The size, texture is very different, so this confuses your baby, and the baby will not be able to feed well. And also there is incorrect use of breast pump. So when you fix the breast pump, if it is not fixed well, you may find that the nipple is irritated, and this causes the cracks. And given that when you have the cracked nipples, you are not supposed to stop breastfeeding unless it is very painful, and you may opt to pump the breast or just express by your hands. That way may relieve the pain. But when you are having these cracked nipples, you may want to treat them, and the first thing you may consider is to put warm salty water in a bowl. Then you soak your nipple for around 1 to 2 minutes. Then you remove it. Then you patch a little bit to dry it. But before you breastfeed your baby, you make sure you wipe the nipple so that the baby may not like the salty taste. So you have to make sure you wipe the nipple before you start breastfeeding the baby again, and this can be done at least 2 to 3 times per day. And if you are having some pus or blood, you may consider taking antibiotics for that. Another thing, you have to make sure before your baby gets very hungry, make sure you feed the baby early, because if the baby starts to get more hungry, they'll get irritated, they won't be able to feed well. And also when you are having the cracked nipples, you may find that your baby wants to breastfeed, you are stressed, you are feeling the discomfort, you are feeling pain, so the baby may sense your stress and may not be able to feed well on the breast milk. So considering that, you have to find the right way to latch and position your baby. Just when you're having that cracked nipple, you may find the right way, but if you can't understand how to do it, you may as well contact me, or you may go to your nearest clinic, so that you may be shown how you can attach your baby through the breast milk to your breast, so that they may be able to breastfeed well and get enough milk. That's all I have for today. If you have any questions, kindly put it in the comments. Kindly subscribe to my channel, and let's meet on the next video. Bye bye.